Welcome back to Age Better. I'm your host, Barbara Hannah Grufferman. Today we're diving into groundbreaking new research on how certain health issues like high blood sugar and extra weight around the waist can put us at greater risk for dementia as we get older. My guest is Dr. Margaret Nachtigall, a reproductive endocrinologist at NYU Langone Health and a frequent guest on Age Better. Together, we'll unpack the latest findings on metabolic syndrome, what it is, why it matters for your brain health, and most importantly, the steps that you can take right now to protect yourself. So, let's get started. Dr. Margaret, welcome back to Age Better.
Thank you. Hello, Barbara.
So I'm so excited to talk about this new study that just came out a few weeks ago. And we've covered metabolic syndrome on previous episodes, quite a few times actually. But give us a refresher. What is metabolic syndrome and why is it so prevalent in midlife women?
It is very prevalent. That's absolutely true. So what is metabolic syndrome? Metabolic syndrome is a combination of factors, usually stemming from insulin resistance. And the way you define it is having 3 or more of the following features. So that is increase in your waist when you compare your waist to your hip. So it could be in men, it's a waist dimension if you measure all the way around the circumference of greater than 102, in women greater than 88 centimeters. High hemoglobin A1C, that is a measure of what your sugars have been doing, an average sugar over the last 3 months. So when that's elevated, people that use medication for glucose control, or a high triglyceride level, when people measure their total cholesterol levels, they measure triglycerides. So elevation of that, increasing lipids, or a high blood pressure. What is high? Anything over 130 over 85 consistently.
Mm-hmm.
People that have low HDLs, so very low in men, less than 40, in women, less than 50. Any 3 of those features is metabolic syndrome. That's what it is. So usually what that means is that there's some amount of insulin resistance, and that usually is the culprit or the cause of metabolic syndrome.
And why is it so prevalent in midlife women?
Why is it so prevalent? It's very prevalent in post-menopausal women, I think, because when the ovaries are no longer making estrogen and our bodies are depleted of it, it really increases, or estrogen is an insulin sensitizer, so it increases the likelihood that we're going to be a little less sensitive to our insulin. And when you're less sensitive to your insulin, that means the same thing that you were eating all along now gets deposited more as fat in the middle, central increase in your midline.
Mm-hmm.
And that can definitely increase as you get older. Also, as you get older, we tend to gain weight. And so we have to do more exercise and eat accordingly to prevent that from happening.
Yeah. I mean, I often talk about how we have to reassess throughout our lives, really. Mm-hmm. And every couple of years, you have to reassess and see what's working for you, what's not. And if something's not based on those numbers that you just pointed out, well, you have to make some changes. And we're going to be getting to some of those steps that people can take in a minute. But let's go to the research that I referenced. New research just came out about how, like, creating a link between metabolic syndrome and a greater risk for developing dementia, specifically vascular dementia. Can you talk about that and tell us some of the key findings?
So I think you and I were both not really surprised to see this finding, because I think it's something that we've always thought about and know. But this was an article that came out recently. It was a very large study looking in the British literature. They had a huge number of people. In fact, over 300,000 people were looked at, both men, both women. And what it did is it followed people over time. And at the beginning of the study, they had about 95,000 people who had metabolic syndrome. And then they looked 10, 15 years later, what was the onset of dementia. And what they found is that if you had metabolic syndrome, you were more likely to develop all-cause dementia later on in life.
Mm-hmm.
There was about a 7% increase in dementia. Some other things that were interesting is they did look at what else was associated with metabolic syndrome. And they saw that there was an increase. So if you had metabolic syndrome, you were more likely to be a smoker. You were more likely to be lack of exercise, more likely to have more drinking, poor sleep quality, a history of cancer, chronic kidney disease, and a gene called an ApoE4. So those factors made you more likely to develop metabolic syndrome. So if we take kind of the later on, we'll talk about what we can do maybe to prevent the development of metabolic syndrome. But those were the people that they started with. And then they followed those people over time. They didn't intervene. This was just a study looking at what happens. And so when they look back, the findings that they presented were that there was an increase in dementia.
Mm-hmm.
Interestingly, although all caused dementia, they had a difficulty with memory and problem solving. However, if you looked specifically at Alzheimer's, they did not see an increase.
No, that was an interesting aspect of this
Yes.
study. Yeah, I was struck by that as well.
Yes.
Mm-hmm. Now, elevated glucose levels, you mentioned the A1C test that shows, an average of your blood sugar levels over a 3-month period. You can also just get your, at the moment, glucose levels tested at your annual checkup. But that and fat around the belly, which I call it belly fat. You use a more medical term.
Right. Visceral.
And there's visceral fat, right, which is evil fat, I also like to call it. It is particularly harmful to women, post-menopausal women in midlife. Why is that?
I think people, not just women, but people, it is particularly harmful. Why? I mean, honestly, I don't think we have an absolute understanding of the etiology or the reason why that is so dangerous. But I think what we're learning is that it has something to do with insulin. And there are some negative factors of having too much insulin. Of course, insulin is essential for our bodies. And without insulin, that's when people develop diabetes. So we need insulin, but it's how much insulin and how are we using our insulin? But I don't think we have a direct understanding of why that adipose tissue or why that fat is so dangerous. We know that it's a metabolic organ, that fat actually is processing factors in our bodies all the time. But the exact reason of why it causes these negative factors, such as an increase in cardiovascular disease, and now we know dementia, not that this study alone is telling us this. This is something that has been studied over and over again.
Yes.
This just happens to be one that was published really recently. And I think we both saw it and thought, oh, let's make sure that we can take this and learn from this and use this to try to prevent dementia and metabolic syndrome.
Right, which leads me to my next question. Oh,
Yes.
yeah, it's been ongoing. I mean, as you said earlier in this discussion, we weren't surprised to see the results of the study. Not at all. It's just another study that underscores the reality of certain lifestyle choices. Some things are genetic, of course, but a lot of this is lifestyle. So let's get to that. So let's say someone does have some metabolic syndrome or one or two of these things that you mentioned. How do we mitigate our risks and how can we reverse it?
Well, I think that is what we should really try to focus on. One of the things that they presented in the beginning is when you're looking at the individuals that did have metabolic syndrome, as I mentioned, smokers, people who had more alcohol use, people that were inactive and were not sleeping well and were older, actually. When you look at the people that didn't have metabolic syndrome, they tended to people who had healthier eating habits and who were exercising and not smoking. So I think if we go by that, those are some things that we should really strive for: to eat healthily, to exercise regularly, to not smoke, I might add in not to drink, although I can't say that we've proven that, but I would add that to the list.
And we also have seen so many studies in the last year or two about how there's really no safe level of alcohol.
I think that's right. Yes,
and everyone should be aware of that too when they're thinking about that first or second or third drink.
Right.
But okay, so you talked about mitigating. Exercise. Yes, it's so, and sleeping
Try to sleep well.
And it's all connected because when you move your body more, you're going to sleep better. But one thing I want to just point out is that just a few weeks ago, I recorded an episode with a medical expert who is doing research in post-menopausal women. And she specifically focuses on how to move your body to mitigate some of these risks. And in fact, one of the things that she studied was how can high intensity interval training hit and only 15 minutes a day or even 4 or 5 times a week, not even every day, how that can help to change the composition of a post-menopausal woman's body, meaning how that can help to get rid of that very dangerous belly fat. And her studies show that it can, and it does. So everyone, I'm going to post a link to that episode as well.
I think that's a great idea because it's amazing. I actually learned that from you. I think it's amazing that 15 minutes a day can make that kind of a difference. And so I think it's just a message, even if you can't do the full 15 minutes, even if you can do 5 minutes a day, to do any kind of activity is going to be an advantage.
Yes.
And whatever you're
Absolutely.
able. I mean, some people are injured and it's difficult. You can't get up, you can't move around, but to do something, even if you're sitting there and you're moving your arms or something that you can do to keep your body moving is going to be an advantage. And if you are able to walk, if you can walk and continue to walk at a brisk enough pace that you're getting some cardiovascular exercise, that would be great.
Absolutely. Just keep moving throughout the day. But really listen to this episode and the details of what she proposed. And you did mention if you're injured or if you have bad knees, let's say, and you really can't do some of the exercises, but if you go onto, for example, a stationary bike, you can still do a HIIT program on a stationary bike or a rowing machine or anything like that, as long as you kind of do that fast pace and then slow down and fast pace and slow down. So it is possible. Okay, so we did talk about mitigating, like maybe getting rid of the belly fat some ways. But what about if you are still in great shape and your waistline is where it should be and, it's under that 34 inches or whatever you said in centimeters, and you want to keep it there as you are now postmenopausal? What are the best ways? I guess the same thing, right?
I think it's the same thing. And I would follow your instruction on the 15 minutes. And I think I think sometimes people need medications, eating a healthy diet, exercising, not smoking, sleeping. If all of those factors are not working, then I think it's reasonable. First of all, let's make sure that you don't have a thyroid disease or some other reason that may increase it. And you can see your healthcare provider. But some people need medications. They need insulin sensitizers that can sensitize you to your own insulin, and that can really help. Some people need very strong insulin sensitizers like the new GLP-1 receptor agonists that we've also spoken a lot about.
Like the Ozempic, Mounjaro, and
Wegovy, those 4. Yes. So semaglutide and tirzepatide. So I think that we really wanted to focus on healthy habits and what you can do to prevent this, and starting it at any age, but just to have those healthy habits to kind of get you ready so that you can avoid having metabolic syndrome. And I think just to be aware that it's not just about an appearance. That's really not what we're talking about. It's really about the consequences. And this study just sort of is an awakening that, yes, with this many people and that it was so common, that metabolic syndrome can have an effect on your brain and brain function later on.
Yeah. And we really don't want that to happen to any of us. So, okay, we covered this great research. Thank you so much, Dr. Nachtigall. And I know that you have patients to see and things to do, papers to write.
Thanks, Barbara.
But before I let you go, as always, I always like to ask you, what are your top 3 takeaways that you want to really make sure everybody remembers?
I think the big takeaway today is, one, we reviewed a study that was presented it came from a large data bank in the United Kingdom, and it looked at over 300,000 people. And of those people, 95,000 had metabolic syndrome, followed them over time, and found that there was an increase in all-cause dementia. And that when you look at the people that had metabolic syndrome compared to those that weren't, the people that did not have metabolic syndrome were more likely to be exercising, eating a healthy diet, and not smoking.
Mm-hmm.
And when we look at people that do get metabolic syndrome, it had a higher preponderance of older individuals, of people who were smoking, who were not sleeping, who were not exercising, who were drinking, who interestingly had a history of cancer, had a history of chronic kidney disease, and also had genetic factors that made them more likely to be developing metabolic syndrome. So some of it is things that we're born with that we can't help but just try to keep our healthy habits. So I think that the third and final is to try to live your healthiest, happiest life.
Yay! We like that.
Yes,
Thank
indeed.
you again.
Oh, always good to talk to you.
Always so good to talk to you.
Thanks, Barbara. Thank you for having me.
Thank you, Dr. Margaret. Talk to you soon. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.